So yeah, I'll keep looking at the YouTube questions.
Oh, thank you. Yeah, because we don't have I can't get questions from there. Well, I can open it up, I guess.
Yeah, we'll make sure no good ones get missed.
Hold on. There we go. Okay, good. So we're on YouTube. Yeah, it's kind of early, eh? I don't know if you guys, it's even though we get up early every day, just on Saturday morning when you get up this early, it just feels early, doesn't it?
Yeah.
But you got to catch the rest of the world while they're still awake, right?
I know. I still wonder the best time to do these things, whether it's better to do them on an evening or in the morning on Saturday. But we do get more people from Europe and Asia, right? So
I mean, that's the day that it won, right? The date and time that won when you made that.
That's true.
You made the pool.
Yeah.
We already have our first question.
Yeah, and it's a good one.
Yeah.
We'll save it. Awesome. Going as planned.
I see that. Yeah. Well, listen, we have people joining, and oh wow, yeah, people are asking questions already. That's great. And let me see here. Yeah. So tell us where you're from. It's always nice to see. We got Saudi Arabia representing. We got Brazil, Indonesia, and Canada / Australia, Israel. It's great.
Am I the only South African?
And Ravi is here. You know, I don't know if you guys probably know Ravi Gold. Ravi's always been a regular. In fact, before, way back when we were doing our rounds in person, actually it was Ravi who said before COVID, he said, you know, listen, you guys should start broadcasting your rounds. And little did we know we'd be doing that. So we got to thank him for that one. We got Romania, Poland, Tunisia, Trinidad and Tobago. Good to see people. That's awesome. Ramsay, how are you doing?
For cases, are we going to answer some cases here?
I think we're going to have to answer the question. I may throw some to you guys to kind of lead them off. I'll jump in after. This is great. Keep on. Yeah, so those of you who are just logging in, this is and Matthew will introduce the whole session, but this is meant to be Ask Anything. So I'm glad we're sticking to medicine right now, because I'm kind of worried about some of the non-medical questions that may come up. So it's good.
That was the whole point.
Yes, that's true. And we'll introduce our illustrious panelists, which were together for one of the last times, which is kind of sad. But it'll be a fun session. Ramsay, how you doing, buddy? Which were together for one of the last times. Oh, which is kind of sad. But it'll be an echo there. Ramsay, how you doing, buddy? I think someone probably has their YouTube channel open. Oh, which is kind of sad. Ramsay, how you doing?
I'm fine. I hear your echo, but is it?
You're two of me.
Yeah, I hear the echo, but my YouTube channel is closed. I didn't open the YouTube, only the Zoom.
Oh yeah, it might be one of us. So no problem. Don't worry. So I think we'll probably get started. What do you think? I'll give it over to you, Matt, to introduce the idea, the session.
Sure, thanks. Sorry, my internet just had a speed wobble, so I think it's good now. Welcome, guys. So basically, got to give credit to my wife. She's a big fan of these videos, and you know, of you, Ike. So she was kind of like, "Look, I've got all these questions about your new boss. How about an Ask Me Anything session?" So it was actually her idea, and then I came up with that awesome, intro slide that we'll probably get to that question at the end. Save it for the end. So this is meant to be an hour-long roast of my boss. Just kidding. But we're going to open it up and have like a spontaneous forum for anyone to ask questions. We've already got some awesome questions coming in. Honestly, we're probably not even going to be able to answer all of them, but feel free in the chat to throw anything out there, glaucoma related, so we can all learn together. Stuff about Ike's personal life that we're all fascinated with, because he's been so successful and such an inspiration to all of us already. So that's what I say at the beginning of my fellowship, speak to me at the end. But, it's a privilege to be here, and we just want to kind of pick your brain about all the things we're wondering about. I've got a list here in case we run out, but we're going to keep going, and just everybody feel free to chime in. Ike, just pick out some questions you think will make good stories and interesting conversation. And we might even pull some people onto the panel if you want to come up and chat live, just have a chat and a casual conversation. Over to you, Ike.
That's great, Matt. Definitely, thank your wife for the ideas. I think it's always good to have a nice chat, and it's a privilege to have all of you here. This is kind of a transition time for our fellowship. We have three of our outgoing fellows here, and just to introduce everybody, we have Allah Mufti, who is from Saudi, from Jeddah, and he's trained also in Montreal, and now this is his last step. He's almost at the door, ready to get back to Saudi and be the expert. And I was going to say the king, but I shouldn't say king, but he's going to be a fantastic resource for the region. And I know people are already looking forward to you. You already have some referrals coming to you, so that's kind of nice to see that. We have Tissi De Francesco from Brazil, who is finished a fellowship at Campinas and now is finishing here. And Tissi is heading back literally in a couple days, and we'll be setting off in Fortaleza. And we have Valentino Lozano, who is originally from Chile, who trained in Florida, hence the name Gator Surgeon that we all know of. And is basically, her last clinic is on Monday, so she is basically done, and she will be heading back to the U.S. To practice. And so these three are leaving. It's a little bit sad always whenever we see people that you've been working so closely with for a year. And it's been a tough year, of course, for so many reasons. I'm a bit of a tough taskmaster. I know it's tough love, but also with everything going on, it's been challenging. But these guys have done phenomenally well. This is always the time for me to reflect as well, and maybe we can talk about that as well. We also have Ramsay Juma, who is one of our clinical research fellows, who is here for a second year. So he's still in the middle of things, and he's here, who is from Palestine, and has been here now doing research as well as helping in clinic as well. And then we have two of our new guys here. So these are just starting. We have Matthew Brink, originally from South Africa, who did his training in Baltimore and now is here. And Matthew, you're gonna kind of host a little bit here. And then we have Patrick Kazowski, originally from Washington, trained in Houston, and is here. And so we managed to get these two Americans over the border and quarantine as well. So this is good. I think we'll just jump in. I don't know, Matthew, if you're watching the questions coming in.
Yeah, and we're getting flooded. There was one of the very first ones that I thought was a great one was, can you talk about the McAhmed technique?
Yeah, so happy to do that. I was just thinking, some of these things are going to be a little easier to show with video, and I know we're not going to have too many videos and slides here, but I'm happy just to show very, very basically what it is, because I just pulled out some slides. Let me go this really quickly. So iris suturing, love it. I recommend everybody to kind of jump in and get comfortable with it. I think these provide some of the most satisfying results for patients. And I think if you ask our fellows, I think they probably would say that those are some of the most rewarding cases. I'm going to briefly just show the slides, and I'm going to maybe ask one of our senior fellows to just talk about what challenges or tips with managing this. So this is basically very simple. A couple of things, have a needle driver, have a microforceps, help to pass the needles through the iris. Whatever you do, whether it's cerclage or interrupt the suture, make your pass. And then here's the key point, basically. Use a hook to bring the suture end, both of them out of the main incision. Typically, it's where your main incision is. That's going to be the easiest place for you to work and do your tying. And then literally you just tie the suture as if you were working outside the eye completely. Always have a short end and a long end. So here's our short end, and keep it about 1 cornel diameter long. Here's the long end, and basically loop the sutures, typically a triple throw around the micro tire. It helps to have a micro tire. These are smooth forceps rather than more of a serrated tip, which we use to grab iris or other tissues. Grab it and then pull. So now you have a triple throw along that suture, and then basically slide it in. You got to slide the short end into the eye and holding the long end. Obviously cross over like you would if you were doing it outside the eye. I mean, that's quote unquote how simple it is. Not so simple, but that's how it is. And cinch it down, as you see here. And sometimes you got to go to another incision. You notice how we move the micro tire from the main incision to one of the other incisions to do that. And I think don't be afraid to place forceps or instruments to another incision, and don't be afraid to make another incision to help your access. And that's basically kind of the quote unquote McAmid. This is a full intraocular tying technique that literally is just tying in the eye, keeping the sutures in the eye basically for that part. So I'll just stop there, and I know it's never as simple as the pictures, and I'll recommend going to our YouTube channel to understand it better. But I don't know, any of the fellows want to jump in and say how their experience has been when they're when you're learning it?
Yeah, I mean, two things come to mind. I do like finishing that tie inside of the eye, because if you do outside, like just the mechanical technique, then you're pulling a lot on the iris. So I really do like putting an instrument inside and then pulling. And then, as Ike said, like don't be scared of like using another incision, because I actually ran into the issue that I was through the main and then I just couldn't keep going and couldn't keep tying. So just make your life easier and use another side port.
Great.
Also, other like comment is that during iris suturing, you need to hold the instruments very flat. And this is kind of a challenge because it's not the way that you're like trained. So everything that when you're holding the micro instruments, and your hands needs to be very flat. And you also need to train your non-dominant hand, because part of the surgery you'll be holding the needle driver with your non-dominant hand. So yeah.
Yes, and that's a great point. Valentina and Tissy put together a video. I don't know if that's out there yet or not, but it's a really fun video about how to practice, right? I think it is how to practice your non-dominant hand, right?
We will share it.
Okay, yeah, it's to be a good share. All right, so thank you for that question. I'll give it back to you, Matthew. We'll go through.
Thanks.
We'll try to go through them quickly so we can get to as many questions and spend time on.
How about this one? What surgical technique was most difficult for you personally to master? Like all the way back when, when you used to struggle. Let's have some stories about that.
Well, I still struggle, as these guys. I still struggle in the OR. Boy, the most difficult surgery. I would probably say, working with a complex iris repair, where you've got like torn iris and missing iris and friable iris, and I'm trying to piece it together. And as I'm doing the case, I'm thinking, I probably should have got an iris prosthesis for this case, because, the iris is so difficult to work with. So that I probably would say that would be one of them. I'll also say that, throughout my career since my fellowship, I've had to learn things on my own, right? And when you learn things on your own, you just don't know where to put your hands, where to set up your incisions, and so, no one tells you those things, right? And the fellows will tell you that too, right? I'm like, we don't think about that. So, I would say, I've done more and more, posterior segment work, vitrectomy. I did my residency, but I had to kind of, really understand it more in learning that. Not that it was particularly hard, but that learning curve. And then for me, I never did a single LASIK or PRK in residency. I didn't do LASIK or PRK for my first 5-6 years in practice. But then all of a sudden, an opportunity came, and I said, hey, listen, I think I want to learn some LASIK because I want to do it for my cataract patients, right? I'm thinking, sometimes patients need a touch up, or maybe you want to treat the cornea and the IOL. So I learned LASIK on my own, which you think is pretty straightforward, but it's a little bit daunting when you're going in and you're, for the first time, how to hold your hands, where to sit, not having a foot pedal to control the microscope, so I'm used to doing that, and not having a zoom, it's just little things like that. So that was a bit of a, if you want to call it an anxiety provoked moment, that's what I would say.
Pretty demanding patients too, that crowd.
Yes.
So what did you?
Funny story. My first patient was an ophthalmologist wife, but she's very easygoing, and she was okay with it, and it was a PRK, which was good.
So I'm hearing you encouraging, learning after residency, learning after fellowship. I've heard people say, I'm probably just going to stick to what I know, but I think I want to be the type of ophthalmologist who continues to learn. And if we don't, we're probably going to fall behind. So inevitably, we're going to encounter those times when there's something we've never done before. But, you approach it with, humility, I guess, and just kind of, what's your mindset when you're kind of starting to learn? How do you even sort of present that to patients or how do you tackle that?
That's a great question, because, I mean, a la Valentina and Tissy will be going off in practice. Now, fortunately, all three of them have done so many different kind of cases that, you always have a case under your belt. but there's always going to be a case that you do for the first time. And I think the first thing is, just know it really well, right? Like, all those things that we talk about as far as watching videos, talking to colleagues, visiting a colleague, artificial, eyes and practicing. All those things are going to be great. I think I would say that the next thing would be to pick the right patient, right? The right demeanor. Who not only their eye is something that you think you can treat, but also that their personality and their demeanor is appropriate. And then I think you say, listen, I mean, I feel comfortable with this. This is a relatively new procedure for me. I feel well prepared to help you here, and get their feedback on how they feel. If they feel like I don't want you to be my surgeon, then you got to deal with what you have to deal with. But most of the time, in my experience, patients are quite understanding, and they appreciate your disclosure, and they understand your your preparation, and you proceed. But it also depends on how you feel as far as your own comfort level. And if you have the opportunity to have somebody who can be with you, that's even better. That's what this fellowship is about, obviously. And also, if you can visit somebody and watch someone do surgery, even better. But that's hard nowadays, of course. So I think with videos and with this, and just call somebody up and talk to them. I can't answer all the messages I get, unfortunately, about, hey, I got a case like this. What do I do next? But I try, and those are great opportunities to chat. But that's what I would say.
So leveraging colleagues and people who've done this 1,000 times. Pro tips. Awesome. Any of you guys want to chime in? Just interrupt me. I'm going to give a shout out to Ricky Enzel, one of my good friends, who went through the interview trail with me. She's asking, how do you stay humble, and how do you continue to challenge yourself?
Oh, good question, Ricky, and I hope you're doing well in Arkansas. Boy, that's a tough one. I don't know if you can. I don't know if anybody can say that they're humble or not, right? I mean, I think it's just hopefully staying grounded, but I think it's how you're raised, I guess, right? In the end of the day, and it's always remembering that there's always more to know. As much as maybe I'm not sure. I'd be interested to hear what Ala, Tissi, and Valentina feel about my confidence, because maybe I come across as being like, I know this, I've got it, but I am always doubting myself. I mean, I'm in the OR, I'm talking to you. I shouldn't tell them this, but I'm talking to you, and I'm saying something, and I'm like going, shit, I hope that was the right answer. And it may not seem like that, but really, I mean, I'm always unsure. I'm perpetually unsure, and so I have to kind of remember that, and I think that maybe reduces perhaps some of the cockiness. Now I realize sometimes I have a bravado, which is more a show, more to have fun, not to be try not to be overly confident, but sometimes that comes across, I guess. That's more my playful side. I think that also probably keeps you grounded as well, being a little bit immature, which I'm sure my current fellows will probably laugh about. So that's what I would say. I think it's beautiful to be humble. I think it's beautiful to be humble. It's so amazing to be close to the ground. And I like looking at people who are not humble, and I like to chuckle myself, So yeah, maintain humility. As they say, ego is destructive, it's destructive. And we all have ego. I have ego. I have to admit I have ego. It's destructive, right? To collaboration. So check at the door. And if you think you're humble, then you're not. That's what I would say. If you think you're humble, you're not humble. Okay. Anybody says, I'm pretty humble, guys. I'm a humble guy. No, you're not humble. Okay.
That's humble.
How do you challenge yourself? I think purposely putting yourself in uncomfortable situations, purposely, whatever it is, I think it makes you challenge yourself, and keep on moving and doing things. And I realize that that can also be a problem as well. And I'm pretty fidgety. And I'm always changing something or whatever, and I'm a little hyper sometimes. And I'm probably manic. I probably am manic, whatever, hyper, up and down a little bit. And I think, putting yourself in uncomfortable situations. I mean, some of you may know that when I grew up, I had to stutter, and you can probably hear it in my voice. Like, I don't talk smooth, right? When I talk, I don't talk smooth, right? I kind of, slur a little bit. And so I had a huge fear of public speaking, like massively. And I was in class, I couldn't speak properly. Like, literally, it's so embarrassing. You're reading Shakespeare, and you go around the room, and my turn's coming up, and I know my line starts with "da," and I'm like, okay, will I be able to say it or not? And it's as a 10-year-old, it's really, really humiliating. And so, but you know what? I put myself. I said, I'm going to go and speak in front of the class and do whatever. And I went to speech therapist for a couple of sessions and I didn't need it anymore because I just put myself out there and I just did it. And so I do talk fast and I do whatever else, and it's still not the best speech, but I can talk at least. And that's, that's what you do to challenge yourself.
That's amazing. I didn't know.
Oh, I'm telling you, Valentina, I'm not kidding you. I mean, it was awful. I mean, I'm sweating. I was so fearful. And when I go up and do my talk now, even I still have a bit of fear. Right now, coming to the session right now, right? As I woke up in the morning, I kind of tossed and turned. I'm like, okay, I hope it goes well. What am I going to say? And will I say it well? So
are we going to roast you?
Sure. I'm not worried about the questions. I'm worried about, will I be able to, speak properly? Will I, whatever. So yeah, so that's
it's great to hear, because I mean, I'm sure everyone here who's with us today, like, finds you like an amazing speaker. I feel like everyone's wish is to talk like you. So it's great to know that you're not born like that, I mean, you have time, and it's practice. And I think that that's a great example, that if you want something and you practice, you can become, I'm not gonna say an expert, but just kidding, no, a great speaker like you.
Well, I'm not trying to just butter you guys up, but when I hear you guys speak, I often think that the way you speak and present is better than me, really, and very effective. And I think it is. So I appreciate that compliment. I don't think I'm a good speaker at all, honestly, I swear. But I've always been like, hey, listen, if no one else is gonna, me, right? If no one else is gonna say it or do it, I'll just go do it, right? That's the style. And so anyways, good question.
So not about having no fear, but about having fear and sort of confronting it. And I like that a lot for, all of us. It's encouraging. And, I got to say, I've only been sort of observing the OR like twice at this point, but having you in that OR as a presence that, whether you're faking it or not, that sort of confidence, it feels like you're invincible. And I can see that, sitting next to someone who's not freaking out while you're busy trying to master a technique that is really difficult, it's golden, to have that.
Well, it also comes with a bit of experience, but oh no, there's always a bit of fear, Even when I'm doing a routine pick, I'm like, shit, I hope the capsule's still there. Like, I swear, I think of it all the time. So it makes you, I think it makes you hopefully be really aware and not be, complacent.
Awesome. Thanks for the question, Ricky. That was a good one. All right, we've got tons. Guys, chime in. I know you're finding some awesome questions, so I'll let you guys.
Tanya asked really good questions, so I'll start with one here. It says, do you have any advice for what to do when getting started in collaborating with industry, the new technology, new medications, how to say no, how to say yes, how to do it responsibly, and how not to be taken advantage, warning signs to look out for, etc.?
Oh, that's a great question. And I think so many folks getting out in practice, this is an area that I'm sure is a question and an interest. And I don't know if I have the best answer, but I will say a couple of things. First of all, number one, recognize that industry and physicians often have different priorities. Well, they do have different priorities, right? Industry answers to shareholders. We answer to patients. Now, there's a lot of common ground, but remember that, right? And as much as you're going to be friendly with industry and go out and have a nice dinner and maybe whatever else, there's always a different motive in general when it comes to business. I mean, that's just a reality, and I don't mean to be mean about it, but that's the reality. So remember that. And if we become with that mentality, then we really ethically and morally have a problem. So we have to, first of all, recognize that. Number two, I always recognize that we are always influenced, no matter what. I get influenced, right? Even if I say I have my disclosures and I want to really not be influenced, but I'm influenced. I'm a human being, right? When I get paid to consult or work on a device or have a patent, I have a conflict of interest. And that same thing exists when I have an idea or when I don't like an idea. If I don't like someone's research, then I may also have a bias. So there's biases everywhere, but financial conflict of interest with industry is important. So first of all, I remember that. Second thing, I will say though, like, the beauty of collaboration with industry is incredible, right? We would not advance if it wasn't for the partnership between physicians and scientists and industry and business. And I particularly enjoy the startup world. It's hard to break in, of course, in that area because there's thousands and thousands of physicians and so many ideas, and how do you get your idea forward? I think that number one, I think certainly having someone to mentor you is helpful. So someone who's been there, who's consulting, giving you some advice. Industry, of course, is always looking for people to work and do things. Most of the time, it's because they want you to help show how good their product is, right? Which is fine. Recognize that. I'm sure for most of us, it's more like, I want to help develop something. I want to help study something. So our mission may be a little bit different. But it often starts with that. So I would just find the right opportunity to, have something you're interested in. Let's suppose it's a different intraocular lens, and maybe you've developed some way to use it effectively, or a glaucoma surgical procedure, and do it. I would say when you're starting your career, I would try to put your own stuff out there. Nowadays, it's very easy to do that, right? I mean, we have great examples here with Valentina and Tissi, Alla. These guys post their videos, they post their thoughts, and you have a platform already. And so you don't need to have industry to help to amplify that. You can do it yourself, and you will find then that industry will come to you. It's very flattering when industry comes to you, right? So don't. It's understandable, but always, you don't want to come across as being difficult to work with either. And so you want to find the right medium. And I think nowadays, I think there are enough rules in place that usually I think allows you to do that, hopefully in a fair way. But be mindful of that. I think one thing to be careful of is you don't want to be a mouthpiece. So if they come to you and say, "Oh, listen, I want you to give a talk on this new drop, and here are the slides, and go present it," then be a little bit careful, because that could end up you looking like a mouthpiece. Now, unfortunately, the reality is that industry has to work on compliance, so they have a certain compliant slide set to work with. So you have to kind of work with that slide set. But you can if you prepare ahead of time, hopefully there'll be some flexibility to allow you to bring your own information in there. And if not, then you have to really add your own flavor. Just because there's a slide to it doesn't mean you have to read everything. You can give your own opinion and give your own thoughts, and do that way. So that's what I would say. If you have a new idea, most of the big strategics are probably not going to be open to listening to you right away. Unfortunately, I hate to say that. They got a lot of different ideas. Work with a smaller company, right? There's a lot of smaller companies from outside the US and even in the US that work with young folks with new ideas. And that's often where things start. For me, when I started, I didn't go out to try to work with industry. I just started doing difficult cases and posting them. And people said, "Oh, we want a good surgeon to be able to do studies with us, to study a new glaucoma device. We need a good surgeon. We want to take the surgeon variable out of it." And that's how it started. And it was also, walking around the exhibit floor, and I would spend time with the places people were not visiting, some of the small companies like MST, for example, and talking and, having a nice discussion, because they had time, right? If you go to the busiest exhibit booth, then you're not going to necessarily have the time. So take advantage of the exhibit floor. If you have a really great idea, it's gonna float, right? And if you can present it properly, it'll do great that way. So I don't know. I kind of rambled a bit there, but I would say do it responsibly, as Tanya mentioned. But I recommend it. I think it's fantastic. I think it adds a whole new dimension to what you're doing, and I think you can also provide value to our patients by guiding industry about the best place to use a product, because we have the best vantage point on that.
Question, but if you have an idea, what is the first step? Like, you don't want someone to, like, even, I don't know, maybe your mentor, and you tell them the idea, and then they forget that it was the fellow's idea or the resident idea. Like, I've heard those stories. So what's the first step if you have something? What do you write? Do you make your grandma sign, like, because you told her? Like, what would be your recommendation?
I mean, obviously on that part, you have to have some trust, and certainly talking to somebody would be important, because they can help to give you the experience. So, a mentor would be important. I think that, I don't know, it's my own opinion. I mean, when you're starting off, I never actually thought about that, really. Maybe I should have. Like, I just put my ideas out there. I talked to anybody else. Even most of the things that maybe have my name on it, I didn't even put a patent on them or get royalties for them, believe it or not, right? I just wanted them out there. I can tell you that it's pretty. Most of the things I have, I haven't got a patent. I didn't go out and get a patent. Maybe the company did and put my name on it, right? But I didn't go out there first and do it, because I just wanted to get it done, and my goal was not to make money from it. Honestly, my goal was to get it out there and make a difference and have an impact, and get it in my hands eventually, right? So I never did that. Now, usually the industry is very good to me. They will, support me. They will provide, the tools and instrumentation, access and things like that. And sometimes they do provide royalties or consulting and things like that. But that's what I just didn't do that. And I would probably, I'm not the best person to answer that, because Other people have probably done it better where they have protected their stuff. I think that is important. But it's hard to do when you're alone, right? It takes to get a patent, you know, get a patent done, everything else. I don't know. For me, it's just more work and delay that I just didn't want to do, and I wanted things to get out there. So that's what I would say. But I probably would say if you have something to talk to maybe others who have been in the field, I would point to someone like, for example, Malika Hook, who's has a lot of, you know, done a lot of great work in this area, and I think has you know, done the right, gone about it the right way. For example, to be a physician, entrepreneur, and scientist.
So patent process for devices, recommending sort of patent lawyers and people from the company handling the sort of ins and outs of that, you know, not kind of getting too stuck in the weeds with that kind of stuff.
Yeah, exactly. And honestly, I just never thought I had a really great idea that's worth patenting. Really. Honestly. So I thought, what's the point? I mean, who's going to do it anyway? So.
On that note, I love the idea of untangling all the Ahmed devices. Like, do you have any good stories about people who thought you invented the Ahmed glaucoma valve, and like which ones did you invent, which ones didn't you invent?
Yeah, I know it's pretty confusing because there aren't that many Ahmeds, and the Ahmed valve has been such a popular choice. So my most embarrassing story was when I was in New York many years ago, and I was being introduced at a big session, and basically the chair of the department essentially called me up and introduced me and says, "This is you know, the inventor of the Ahmed valve and amazing," and all the rest. I'm like, oh, shit. You know, what do I do? Do I contradict him and make an embarrassment out of it? Do I just accept it and make it look like it's false, right? You know. Now. By the way, the inventor of the Ahmed valve was very happy for me to take credit, and I'm very grateful for him to say that. But that was kind of an embarrassing moment, and I kind of made a joke about it or something, right? Like, I would have been like 10 years old if I invented or something like that. So try to diffuse the situation. But yeah, that's a common one. But
what is the story of the patient that thought that you were the creator?
Yes, yeah. I had a patient who early in my career who basically came from outside the country to make an appointment, and I was like, wow, someone wants to come outside the country to see me. It happens more often now, but and they came in and I examined them, and I said, okay, you know what, you had an Ahmed valve. Unfortunately, it's failed. We need to move on to the next step. And they were like, I'm here because I'm really, really angry. I'm like, okay, what did I say, right? And like, you know, your valve just totally screwed me up, right? It sucks. And I was like, oh my, all these terrible annotations and everything else. And I had to it was kind of funny to kind of step out of that one. That was I let them kind of go on for a while, and then I basically kind of told them the news that you can't blame me exactly, right, for that. And so that was kind of a funny moment. Yeah, the patient, I think in the end of the day it was actually good because I actually helped the patient, but at first it was a bit of a tense moment. So yeah, there's been a couple of situations. It's funny because I've been lucky enough to have my name on a variety of different things that was me. Much more than one thing. But now what happens is that people have gone to Mateen. Mateen Ahmed, by the way, is such a great humanitarian at New World, who now is basically retired for the most part. Who's he really is not only is he a clever guy, but also a real humanitarian. He provides valves and products around the world. People go up to him and ask him, "Yeah, I saw that you're branching out to cataract surgery, or you've been working on this device or other devices." So it is funny how it kind of sometimes goes a little bit both ways. But yeah, I still get that around. It's kind of funny.
Guys, I'm going to chime in and just sort of say, if you can, ask your questions in the Q&A box if you're on Zoom, because then we can upvote them, which is kind of fun. So the most popular questions will float to the top. We got a bunch. Anyone else want to? Irfan's joined. He's another one of
hey, Irfan,
my co-fellows. All right, I'll leave you guys.
I can just go through some of the ones.
Pick some that you like.
Well, how do you maintain a level of learning 20 years post-residency? This is from Ravi Gal. Which non-ophthalmology books do you read? Yeah, I have to admit, I wish I read more non-ophthalmology books. I really wish I did. I just find I don't have time, and maybe I should have more interest in it. But when I do read a non-ophthalmology book, I really enjoy it. I'm a big fan of Malcolm Gladwell's work, and I think the reason why I like his work is because there's a bit of science behind it, right? There's a bit of theory behind it, and so I do enjoy those. I also think, and it's funny for me to say this, but I think sometimes when you read a lot, and this sounds really bad to say this, you get polluted, right? You get you get railroaded into a certain thinking because that's what you've read, right? You've read it, and so you know what, you're gonna think that it's not your own thinking, and so in some ways, being a little bit naive and ignorant sometimes can help you to kind of think of your own ideas. Now that sounds terrible because then you got to read your textbooks, you got to read the big papers and everything else. But I just haven't had enough time to do it honestly, and that's been probably something I wish I did more. I do like to read the news and stuff like that, but I can't sit down. By the way, I can't sit down for like 2 hours and read a book. Seriously, I'm going to do that. Sit down for 2 hours on a beach and read a book. Like that is impossible for me to do. That never is going to happen. I'm going to probably stand up and probably start making sandcastles or throw someone in the water or start a fight or something. Right. That's what I would be doing. And love of learning, man. I have to say that being surrounded by learners and being surrounded by people who want to learn from you, it really makes me continue to learn. And I don't, again, little known secret. I learn a lot from my fellows, in terms of how they are thinking and what ideas they have and their challenges and my challenges. And I think that just allows me to continue to learn. And I think it's learning a new thing is such a beautiful feeling, right? Isn't it amazing to learn something? So that's what I would say, Robbie. Thanks for the question.
Can you speak a little bit about your fellowship and training with Alan Crandall?
Yeah,
any good stories?
Alan is my mentor, and before I did my fellowship as a resident, I never really had a mentor, someone who I really could connect with, someone who really allowed me to be myself. Right? That's I think what is ideal. Someone who can allow you to be yourself, but still not let you be yourself completely, because that goal for that mentor is to push you into maybe places where you don't think you can do, or where you think you're not. So it's kind of a fine balance, right? You want someone who's not going to turn you into them, but you also want somebody who's going to push you to be beyond what you think you are. Really, hopefully in a good way, right? And so Alan was like that, but Alan's a pretty quiet, very humble man. So I would be doing cases and I would think, wow, I did a really, really amazing case. And he would say nothing to me, like zero, right? Just walk out of the OR, right? And I'm like, oh, I'm cool with that, right? But then at the end of the day, I walk out of the OR and I go into the OR lounge. And then the nurses, everybody would say like, oh, Alan was raving about your case and so how amazing it was, right? And it would be like, wow, he didn't want to say anything to me, just his personality. And yet he was, telling everybody else. So Alan was very much about, putting yourself in the seat and let you do your thing. You live and die by that. And probably my fellows will probably tell you I'm probably in some way similar, not quite the same, in that sense of doing that. And he taught the basics. He taught about saying, when you're doing complicated cases, you got to do the basic stuff right. And you guys hear me say this all the time. He would slap my hand if I was moving my hand. So you guys, I don't do that as much, but it really ingrained in me those principles. And he ingrained about videos and about watching videos and really a brilliant surgeon, brilliant man, humble guy. I still to this day think about what would Alan Crandall do if he was sitting in my seat right now. What would he be telling me? What would he do? How would he handle this? So I owe a tremendous amount to Alan, and that's I hope everyone has a chance to have some mentor in some way, because that really provides a bit of a guide and pushes you a little bit.
Tell us the story that you broke your wrist during your fellowship.
Well, that's a good story, because Alan also was the kind of person who would, again, not let anything faze him. And so, yeah, I was as a fellow, I was in Dallas, Texas, Fort Worth, Texas, with a bunch of other residents and fellows, and we had a challenge to say who's going to be able to stay on the mechanical bull the longest, right? It's a good challenge, right? And and one thing, I'm very competitive. I'm very competitive since I was little, always, right? I mean, I always have to kind of put, be first or want to be first. And so I basically, I was kind of the last person to do it, and I had to be on it for like, I don't know how many seconds it was. So I was on it, and I was just, my wrist was killing me, right? My right hand was just killing me. I'm like, no, I'm gonna win this thing, right? And so I go on there, and I lasted. I fell off the thing, and I'm like, okay, my wrist hurts, fine, it'll be okay. And I went back to Salt Lake City, where I was in my fellowship, and and it was my right hand, by the way, and basically it was hurting and I couldn't do much with it. And I kind of brushed it off for a couple of days and I tried to work in it. It was really hard. So then Alan said, listen, man, go get an x-ray. I got an x-ray. Of course, my wrist was broken, right? And so the doc said, listen, this is dangerous. I mean, you break your wrist. If it doesn't heal properly, you could really affect your career. But I'm in the middle of my fellowship. And so they wanted to put a cast all the way past my elbow. And I said, no, I'm not going to do that. So they gave me a little splint. I still have my splint actually. And it was a splint that I put on my hand. I could walk around with it, but I took it off in the OR. I wrapped my hand up with tape, and I put a glove over it. And I was like, Ike, you can just operate with your left hand. Take it with your left hand. You can hold the chopper and not move your hand and just do that. So I basically did 6 weeks or so of mainly using my left hand. And Alan was that kind of guy who would let me do that. But I think he also, knew that I could do it. I mean, I don't think he wants to put patient safety in the way, but we always talked about bimanual stuff. So yeah, I was walking around with a. I always joke around. I was walking around with a splint on my hand. I'm in Salt Lake City, and that was the same time, by the way. I also had a black eye. By the way, maybe we'll come back to that later on. So literally, a week before that, I don't know, a couple weeks before that, I got a black eye. I'll tell you how it happened later. So I'm now walking with a black eye. I have a splint on my hand. I'm a brown guy, black hair, green eyes, the devil in mainly Caucasian, Mormon country. So it was quite a pretty interesting scene in that environment. And by the way, I mean, again, Alan's one of those guys who there are rules and then there are rules to be broken, and that's kind of where Alan was very good about allowing you to do that and be yourself. So that's a quick story there. Sorry, I'm going on and on.
Love it.
So
thanks.
you talked about bringing new innovation through the industry. How about bringing it to the public? I know when you started up the MIGS idea, when you went to speak to public at the beginning, like there was a lot of scrutiny, a lot of skepticism. How did you finally get people to actually join your MIGS club, like eventually?
Yeah, I mean, that's a good question, Allah, because, nowadays everybody wants to be MIGS and stuff, but back in 2009, 2010, a long time ago now, I mean, it was pretty rough, man. I mean, my colleagues were not really very conducive and open to it. And it was like really like I would get shout down and a lot of angry comments. And although now things are online, and even then things were online, it was a challenge. But I think what helped was, number one, I did have someone like Alan Crandall who was still able to be my support. And I didn't have like an in like, as much as Alan was everywhere, Alan wasn't the guy who was running societies or running, meetings and stuff to say, oh, I'm going to put my fellow on the podium, right? Or so I had to basically inch and scrum out and work my way up. I think I got some credibility maybe because of my surgeries. I mean, everybody for the wrong reason respects a good surgeon. It's kind of how you make your mark. And I would recommend, again, for those of you to do that, to maybe put yourself out there and show your cases, because it does show, what your abilities are. However, I will say that is not what defines a great physician, because that's just the technical part of it, but it did give some credibility. And in the end of the day, yeah, I think I was lucky enough to grasp onto YouTube and social media maybe earlier, right? I mean, in my generation, right? Nowadays, everybody's doing it. I just started TikTok, by the way, so watch for it. Get ready, new fellows. And so I was able to just put things out there and amplify it, using means that are not traditional. I didn't have to wait to get published in a peer-reviewed journal and get shot down. I didn't have to go to the American Glaucoma Society or to the AAO and have to and find a place to present. And in the end of the day, it actually starts from just listening to our patients, right? Because these ideas came from patients who had fear of surgery and who were not doing well on drops, and we needed another solution. And MIGS is not there. MIGS has a long way to go, but I think it resonated well with patients. And now you see patients who are driving, and they should be driving, the demand to reach quality of life and that stuff. So, that's kind of where it started. And honestly, I think I really took a lot of great comfort with my fellows, right? My fellows were out there, also doing this. And I felt it always is great to be part of a team. When you're part of a team, you have that strength around you, right? And I am not a person who likes to do things on my own, right? I love to have co-authors, colleagues, collaborators. Maybe that's probably why I have a fellowship in some ways as well, because you're doing things together, and the joy of doing it together. So that really helped and supported. Sorry, I'm talking a lot. We should make sure we get through questions. I'm sure we're going to go way more than an hour, but.
I like this one. What is a normal day in Ike's life? Like, what time do you get up? What do you eat, if you ever eat?
When do you
And how do you train your superpower?
How do I train my superpower? So great question. Yeah, good question. So my day, I used to be a night person and stay up late night and wake up like 15 minutes before I had to get to clinic and shower and run, right? But now I basically get up around 4:30 or 5 o'clock in the morning. I use that time to review messages or to read or watch videos, again, ophthalmology. And I use that time to work out. And often when I work out, I have a treadmill and I have an elliptical machine, and I can, watch my videos and do emails on that, or go outside and go for a run. And then I use that time to kind of do my writing and things like that. And then my family gets up, my kids get up. I'm typically almost out the door, and I had to work. I don't eat breakfast. It's sad to say that. I skip breakfast every day. It's bad to say that. And I get to work and I basically hit the ground running, and I don't stop, right? I don't even stop. The advantage is I don't have to go to the washroom because I haven't drank or eaten anything, right? So I do carry a couple of water bottles with me after I work out, whatever. And then work all day. You guys see me work all day. I don't have lunch, right? Although I'm looking forward to Monday. I heard the fellows are having lunch on Monday. And then I finish my day, and usually on my way to work, I usually have a couple of phone calls to make that my Daisy sets up for me, like calls with people or companies or colleagues on my way to work. I get to work. I work all day. I can't really answer messages all day because it's pretty busy unless I'm in the OR, and often I can do that. And then I finish my day. I try to finish seeing patients and stuff by about 3 or 4 o'clock. And then after that, I have meetings and stuff, right? Like hospital meetings or clinic meetings or research meetings. And I try to get home somewhere between 4:30 or 5 or 6. And then that's basically my chill time with family and kids and stuff. I'll usually eat then for the first time and have my dinner. So I'm intermittent fasting all the time, right? Although it doesn't show, man, because I put on weight so fast, right? If I don't keep in shape, which I've not been keeping in good shape lately since COVID. And then I basically, have some family time, do some stuff. There's my little 6-year-old. It's her birthday tomorrow. And then by the evening time, I basically go back and do a bit of work, a little bit. I have to admit, sometimes I bring my laptop into bed and do a bit of work, and that's not a good thing either. My wife's a family doc. Probably she does a little bit of that as well, and then try to put the stuff away and try to get to bed around 10:30, 11, sometime later. So that's kind of my day. I don't know, pretty boring in some ways. And my weekends are pretty chill. Like this whole weekend, I will probably do no work today. I probably will do some work tomorrow to prepare for Monday. And yeah.
I was wondering about that myself.
Without traveling though. So imagine all of this and being everywhere in the world. So I don't know.
The traveling part's a whole other story. That's a very good point.
There was a question on here that I liked. How do you prepare for live surgeries? So like, as you mentioned earlier, I mean, you used to be afraid of public speaking. Live surgery is insane. I mean, what's going through your head? Like, how do you do that?
Yeah, I think there's probably a bit of a natural kind of feeling of being comfortable with people watching. And sorry, this sounds bad, but just being comfortable in that environment. And then there's obviously hopefully being comfortable with being prepared and having the skills. I still get nervous when I start, but I go really well prepared. I really learn everything, even sometimes the language, right? I've been operating in Spanish a few times, so I know some of the Spanish words. But as you fellows will know, when you're in my OR, what's it like, right? It's crazy, right? The music is going on, people are talking, visitors are watching you. So I can tell you right now, Valentina, Tissi, Ala, you guys are already prepared to do live surgery because you've been doing it all year. You've been, think about it, right? I know the first days you guys came in, you're like, oh my God, like it's not quiet. I'm talking to people, not only me, I'm talking to the nurses, talking whatever this. People are watching me from all over the world, and you guys performed amazingly well, right? So really, you're doing it already. And so for me, I have people watching me every day. I'm doing surgery. I need to look good and do well for my fellows watching and for the video watching, right? So having a video too is good. So it's kind of a natural thing. Where's the challenge is, of course, working with people who don't speak your language, having instruments that aren't your own, having a microscope that doesn't work well. Those are more challenging cases. I would also say that going and doing humanitarian work helps as well, because you're going and doing surgery in another, it's not live, but it's, you know, so, but there's also ethical questions as well. And I don't think it's for everybody. And I think you need to pick your right cases. I go to do live surgery sometimes, and the patient's like, "Oh, this is a simple case of a dislocated cataract." Okay, so I'm okay. I can do that. I go examine the patient. The patient has new vascular glaucoma, right, and has like active NV. And I'm like, okay, you know, so you know, obviously, then I didn't do that case. So you have to be prepared to say no as well, and I've done that before too. And I bring my own instruments, by the way. I bring my own set with me, which I have to check in now because. You know, TSC doesn't like taking sharp instruments through most of the time. So yeah, that's how live surgery's gone for me.
Credit goes to Maritza Quintero for that question. So.
Oh yeah, good old Maritza's got a great story as well. And I will say there are some great stories from people, and I love to hear people's stories. And Maritza's one of those stories. So thank you.
All right, guys, chime in. I've got tons here. So
throw them out.
Let's see.
Quick and fast ones.
Anonymous attendee, if you weren't in the medical field, what do you think your alternative career would be?
I would be a lawyer. I would be a lawyer, and I still wish I was. I would be a lawyer, a human rights lawyer. For me, fairness is so important, and inclusiveness and diversity. And I hate it. I hate it when people are mistreated. I hate it when people are oppressed. I really hate it. It really bothers me, right? I mean, I can't go to sleep sometime when I see something happening around the world or even in my own country, and people being mistreated. And I think it probably comes a bit from my history as well, because I grew up in a small town in the middle of nowhere in northern Saskatchewan. I was born there, and you know, there aren't too many brown people there, and so I don't want to be unfair because I'm very grateful for my upbringing, but you know, you get picked on as a kid, right? People cannot pronounce my name. I got made fun of all the time. I got in so many fights. I cannot tell you how many fights I got into, and people that were older, right? And so you kind of grow up with that chip on your shoulder a bit, right? So for me, that's always been something. And by the way, speaking of fights, I never backed down from a fight. I don't care if there were 4 kids calling me Packy, right? And they said, egg ball, you know, say Packy, we'll leave you alone, right? And I'm like, no, I'm not saying that word. No, I'm not saying that word. And I would get the shit kicked out of me, literally. And I'd go home and I wouldn't tell my parents because, you know, you feel like you don't want to bother your parents. So I had to talk about, you know, I was playing, you know, football or soccer and got thrown to the ground, whatever. But that doesn't, first of all, it makes you a good fighter. And secondly, and I still worry about now, because nowadays, of course, you can't go out and just fight with somebody. You're going to get shot or something, right? So, but those kind of things really, I think they affect you, right, when you grow up. And so, yeah, I would love to have done that. Maybe I wish I did it now. And that's probably one of my things I kind of wonder whether, you know, what impact am I having in life and in the world? And I wish I could do more.
Awesome. Chime in, guys. I don't want to hear the sound of my own voice. Let's
keep going. I think this is a good one. What do you anticipate will be the future of ophthalmology 20 years down the line? Robotics, functional prosthesis. What do you imagine is on the horizon? Yeah,
I mean, great question. I mean, obviously, all the catchphrases like, you know, genetic, you know, therapeutics, neuroprotection, you know, bringing technology into the eye and seeing all that stuff, I think is really exciting. And I'm sure it'll be happening. I think that, you know, right now, of course, and with COVID, certainly we've moved into that, you know, personalized, you know, outside the clinic, you know, screening, diagnostics and all that stuff. I mean, I'm working with companies that are working on technology on a smartphone that basically can detect whether you're at risk for glaucoma. I know it sounds wild, but you'll be able to use your smartphone, and the way you use it and the way you interact with it would be able to pick up potentially certain eye diseases. And that's something that I can't take credit for, but the people that I work with, I think, have some great ideas on that. So I think that, you know, more and more, and this is important for all of us. I mean, you know, the things that we do now, we're not going to be doing in the future because we have technology that can diagnose, screen, and everything else, and potentially even treat. And so always keeping moving and always keeping ahead of the game is important. I think status quo, as Alan always taught me, if you're doing the same thing as you did 6 months ago, you're behind, and status quo by definition equals lagging behind. So always kind of thinking a few steps ahead is important. So that's what I would say. I think that obviously there's still a lot of hurdles to meet, and there's a lot of ethical questions to ask about that. But I certainly think ophthalmology has been on the leading front on so many different therapeutics, and it'll be also in the future as well.
I wanted to ask, what's your most controversial belief about glaucoma ophthalmology that you can't prove? Like a hunch you have that you just don't have evidence for, and maybe no one will ever be able to prove. Like, is there anything that comes to mind?
Wow, that's a tough one. I don't know if I have anything that really is that controversial, other than just I believe that that we need to you guys have heard me talk before with interventional glaucoma. I don't think that treating with eye drops is really the right answer for glaucoma, right? We need to be fixing the plumbing or enhancing outflow for different ways for now, and of course in the future use neuroprotection and genetic therapeutics to address the problems, both either on the outflow side or on the neuro side. That's probably what I would be. I don't know if I really, honestly, I have to say, I wish I could give you some breakthrough things, but I for me it's pretty simple. I mean, I think that's what needs to be done. I think that in the IOL cataract world, I'm probably again in the middle of things. I'm not someone who's thinking everybody should have multifocal lenses, but also I think it's great to be able to offer everything to patients and individualized care. So yeah, I don't think I can't think of anything that's really that earth shattering. I think there's exciting work being done, for example, with CSF and the role of CSF pressure and things like that, which is interesting. I'm very fascinated about normal pressure glaucoma and what's going on there, and understanding IOP better. I think IOP sensors are going to be really cool and interesting to kind of see what's happening. I'm still one of those people who kind of is probably more of an IOP guy when it comes to glaucoma, although there are, of course, different associations with non-IOP factors like perfusion and other things. But yeah, that's my suboptimal answer. I hope you guys will come up with the right ideas for that.
We have a question here. What patient's personality makes you most anxious? How do you deal with this?
Yeah, so it's a good question.
Yeah.
It's always about trying to meet expectations in life, right? Whoever you're with, patients, whatever. I worry about the patient who is expecting more than I can do, whether it's because they have a misperception about their disease or a misperception about what I can provide for them. So as a patient who has really, really high expectations worries me. And usually I get that sense as I speak to them and I give them my sense of what to expect. And then the answer comes back and says, but I won't need to wear glasses ever, right? Whatever it is, right? So that kind of does worry me and provide a bit of anxiety as well. I do worry about the patient as well, who in glaucoma, for example, who maybe is not as engaged. I worry about that patient may not be compliant and adherent. I worry about the vulnerable patients who don't have the right support structure around them. I mean, I'm getting a bit broad than personality, but that's what worries me. And yeah, I mean, I try to give people benefit of the doubt. I mean, we all have patients who are difficult, who have a million questions, who are demanding, and it's natural to get your back up, and I do as well. But those ones I think certainly make me anxious, because it's like, okay, I'm not, we move, the conversations move from let's get you better to arguing about I'm waiting in the office too long, or I'm this or that, whatever. So how do I deal with it? I think number one, listen, right? I mean, let the person you're speaking to have a chance to speak. I think setting down the expectations and saying, listen, I can't answer all your questions. I'm here to do this. I don't have the answers for everything, but let me just try to provide what I can do here. And if this doesn't work, I may not be the best person for you. I mean, physician-patient relationship is so important to your care. And there isn't always the best fit. I mean, it could be certainly me. I mean, I put it back on myself, it's probably me. I mean, I may not be the best fit for you, right? So, because I don't like to continue a relationship when the relationship is strained, right? That becomes challenging and difficult. That's from Myrna. And I would say Myrna Lichter, who has taught me a lot about, doing the right thing, helping those that are vulnerable. She has done work with Syrian refugees and folks that don't get access to care. You know, it's she's done a lot for that. And I'd probably say she probably has a better answer than I would on this, because she has managed people, you know, and challenging situations very well.
So you have the privilege of having the most equipped OR, I would say, in the world, like a 4K microscope. You have all the tools and gadgets and every kind of device that even people haven't implanted in different countries. I guess the reality is, for even for like me, TC, and Valentina, like when we go back home, we won't have necessarily all of this equipment. What are the things that you would fight for, like in terms of tools in clinic or devices in OR that you would be your must-have, I would say?
Yeah, I think, yeah, you're totally right. I am privileged. I am privileged to have what we have here. I will also say, when I came back from my fellowship, I wanted to, and this is a long answer, sorry, but when I came back from my fellowship, I wanted to be an academic, full-time university person. But there was an opportunity, politics, whatever else. So I ended up working in a place which I'm grateful to work, where I am now, in a small hospital. There were only 3 ophthalmologists. There was a pediatric ophthalmologist. There was a colleague of mine who does extra cap primarily, still doing extra cap at the time, and then someone who was doing about 8 phacos a day. And I came, right? So we had literally nothing. But for different reasons, I can, you know, go through it later or some whatever, we managed to get to where we are now. So I will say that, you know, don't think about things now. Think about what you can build for the future. It's not going to happen overnight, right? I mean, I think I took an idea and a concept, you know, into reality and collaborating and everything else, and it became easier over time. That's the first thing. Second thing is, yeah, I think the basic skills are what's most important, but there are some instruments that are critical. Like, for example, for me, I think having the best microscope is important. Like, for me, I think you got to have the best view, best visualization, see what you're doing. And nowadays you can get a recording system that you can attach to it and watch your videos. You have to watch your videos. You have to watch your videos, man. Otherwise, we won't be able to improve and do better, and also share as well. I think when it comes to instrumentation, I would say there's a couple of things. Like the capsulorhexis forceps, for me, is the most critical instrument for cataract surgery. I can work with pretty well anything else. Most phaco machines nowadays are pretty good. Blades, I can use metal blades, even reuse them if we have to. But I need a good capsulorhexis forceps. That is the most critical part of the surgery for me. And I would make sure I had a good pair of forceps, and that's important. Because of the complex work, I think I have to have some micro instruments, you know. And as you know, I work with MST. Other companies are out there too. But having a micro forceps and tires and micro scissors for any basic complex work is important to do. I would say that's important. And then for glaucoma surgery, you know, with trabs and with suture GAT, you can cover a lot, right? Because once you get into devices, of course, it adds an expense. And so that's something that I know everyone doesn't have access to. But even with a suture and with, you know, a pair of Vanna scissors or a punch, you can do a filtering surgery, or you can do a mixed procedure. So, you know, that's what it is. I mean, I think that, you know, you start there and you kind of build from there and work with what you have.
We've got Nikki M. Outside of ophthalmology, who do you find influential? Can you tell us some stories about cool people you've met, and maybe outside ophthalmology? I know you met Elon Musk once. That's cool.
Yeah, I mean, yeah, no, that was great. Outside of ophthalmology, who's most influential? I would probably say I as much as it may seem differently, I do get influenced a lot by people. I see people and I'm like, wow, I want to be like him or her all the time. And so it may sound kind of funny, but my most amazing experiences have been with strangers. I know it sounds funny to say this. I love meeting strangers. And this is maybe one reason why I travel. I love going to the airport and you know, in the terminal or on the airplane or walking out or going to a place, meeting someone I've never met before, because it's an open book. It's an open book, and you can learn just so much from that open book. And I can't even tell you all the stories I can think about in the friendships I've made just from those random occurrences. And even online nowadays, it happens. Sometimes you get in trouble, of course. Somebody's maybe, you know, has a different intention or stalker or whatever else. But you know, I think meeting strangers is amazing. And I know it sounds pretty, maybe a cop-out answer, but I learn more and enjoy those experiences much more, and they're fulfilling so much more than having somebody who's, 10,000 people want to go and watch, And I've been fortunate enough in my career and in my life. I've been lucky enough. I've been privileged to meet people, whether I've been in the social circle with them because they have common friends, like tech billionaires or others, or maybe they're my patient, like entertainers or multi-platinum artists and whatever else, or politicians or prime ministers, in my house, whatever else. But there's a certain barrier with that, right? No matter what, because, unfortunately, everybody wants to talk to them. And when they talk to you, it's never quite natural. I mean, of course, if you've grown up with them, maybe it's a bit different. So for me, yeah, I mean, I love that. And I will tell you, even, working with residents and fellows. I mean, that experience is such a great experience. As much as it may seem like it's a one-way street, it's not a one-way street. I observe and watch and learn, and especially as we get to learn to know each other, it's pretty neat. So yeah, a lot to learn from people that are anywhere. I mean, it's incredible. Like I said, even going to the grocery store. I mean, there's always somebody you may meet that could change your life, and I always believe that. I believe that every day when I wake up in the morning, that I may meet someone who's going to change my life, and hopefully for the better. And I think if you have those blinders on, you're not looking for it, then you're not going to meet that person or be in that situation. But if you have your eyes open and you're looking around, like when I'm walking around or driving, even I'm always looking. I'm the person. I'm driving, and I'm looking. I'm at the stoplight. I'm looking. Oh, who's in that car next to me? Who's in that car next to me? I'm literally looking at people everywhere. I people watch all the time. I try not to stare and be creepy. Sorry, I don't mean to be like that. But it's genuine curiosity and it's genuine interest in just learning from people. I get energy from that. I think it's amazing. So that's kind of my weird answer, right? I mean, I'm definitely weird. I think my fellows, Valentino will tell you, she agrees with that statement. I'm definitely weird. She called me.
When you're saying this, I just can recall that hospital encounter with that patient, with that person who was trying to go to personal relations.
Yeah, what was that story?
Sometimes you want to talk to people, but you start like you want to push them, so that they start getting
true. My other feature is I do push people a little bit. I do push people, and I do push sometimes just to kind of, just to hear them out and maybe to let them hear themselves. Sometimes we don't hear ourselves enough. We don't. I know it sounds kind of funny to say that, but sometimes you got to push people to kind of hear themselves, especially people who you're comfortable with. And sometimes you have to get in trouble when I do that because people then get angry or upset. Yeah. So there's never a perfect way to do it.
There was a question here about who do you have like as someone you disagree with, like a sparring buddy? Like, is there a topic that you find yourself arguing with somebody? Can you think of someone like that who you're constantly going back and forth with about? I don't know. I guess it doesn't have to be glaucoma stuff only.
Well, first of all, with my fellows, right? And I'm not always right. I'll admit that. So that's always been a good part of it. As far as colleagues, I mean, there's so many out there. I don't want to name folks, but we often have a lot of chats and discussions, and I learn a lot from the leaders in our field, and also from those that aren't in the spotlight, that randomly come up in a meeting and have a really good point to challenge you, and I think that challenge is fantastic. I don't think we should ever look negatively about someone who challenges you. I think it's a positive thing. If someone challenges you, look at it as a gift. It's a gift that's been given to you to make yourself understand better.
Let's use that as a segue. Challenges of getting into ophthalmology. A popular question: why do you think ophthalmology has become increasingly one of the most competitive residencies? What advice would you have for, I don't know, people who have been told no, you can't get in, or it's impossible? Anything to say to those folks?
Yeah, I would say impossible is nothing, right? I have a little piece of paper stuck to my wall that always reminds me of that. I mean, ophthalmology, we're so fortunate. We have such an incredible specialty for everything we do in terms of what we do, how we do it, technically how we do it, the optics and the physics of it, the value of sight, the most precious sense of our lives, and so it's a sacred thing to do. We also benefit from having generally a fairly well-balanced lifestyle, although I probably pushed the limits on that. I was one of those guys who wanted to be an orthopedic surgeon, and the adrenaline rush of a trauma room. And so I work in ophthalmology with an adrenaline rush, but you have the opportunity to do so many different things and collaborate with so many different people, including technology. It's very technology heavy. So I think it's amazing. And for that reason, understandably, it's been competitive, and it probably should be. More and more, although residents are looking for the traditional applicant, they're really smart and whatever and perfect, perfect box. I think those things are getting broken down more. I hope they are. I've served on the residence committee here at UT for a long time, and we all bring our own things to that process, and for the fellowship. I try to look for people that don't necessarily fit a mold, right? And I mean, hopefully, even you can look at our fellows in terms of our fellows coming in. I mean, there's no one, do this and this and this, and then you're going to be a competitive applicant for my fellowship or for residency. So, know your strengths. Don't try to be somebody else. Be respectful as a respectful person. Everybody always likes somebody who's respectful and close to the ground, doesn't come across as being too difficult. If you're shy, that unfortunately can appear to be someone who's underconfident and can't communicate well. So you have to find a way to communicate your thoughts, because otherwise people don't know you. And if they don't know you, they're going to do the safe thing and not select you to be on their team. So
I like this one.
Oh,
yeah.
Oh, sorry. Okay, so one question. Let's just go back to when you start your practice. Did you already start like performing surgery, like complex cases, or did you choose to do more like routine surgeries? And what would you recommend to me, Valentino and Ala, to how we should start our practice regarding cases, surgical cases?
That's a great question, Tissi. And I think I sometimes wish, and I'm going to do this, that I wish I could give you my video from my first year in practice. Because you guys see me now operating and think, oh, whatever, it's no problem. But you will see my struggles and my challenges and my complications, first of all. I think, listen, you're ready to go out there and conquer the world. I mean, I truly believe that. I have no doubt that you have the ability to do that, and you will. I also think you have to be careful having a long hiatus between when you're finishing your fellowship and operating and doing complicated cases. You don't want to wait 2 years and then start doing your complicated cases. When you come back or wherever you go, people are, for better or for worse, going to save some cases for you and maybe throw some difficult cases to you and say, okay, this patient is a one-eye patient with one zonule with a pressure of 50 and take care of it, right? And they're going to expect unrealistic expectations. And you're going to have complications no matter what. I will have complications on that patient. And if you start your career having all these complications, then it becomes a bit of a negative tone for you and for your colleagues and your patients. So patient selection is important. I mean, I think you don't want to start doing the most complicated cases from day one. You want to pick and choose the ones you do, but don't not do them. So I would say, get comfortable, get the routine going, build yourself up to level 1, 2, 3, 4 with complexities, but hopefully hit the level 4 within a year, because I think then you're comfortable and you still have the muscle memory and the things, or come back and visit so we can see you again. And so, I think that's a really important point. So I had a couple of fellows before that took on some really difficult cases from the beginning and had bad complications. Understandably, I could have had a complication in that same case, but it left a negative tinge. And I'm always very worried about the perceptions. I know perceptions shouldn't mean everything, but you want your referring doctors and your patients to be confident in you, right? No matter what. And success breeds confidence, and failures does it, even though the failure is likely to happen in a difficult case. So, just consider that, I would say. But I hope that you'll, push yourself. And, there are some that will go out there and just do regular routine cataract surgery, and that's all they'll do, which is they'll do very good at it. But I always try to say, listen, use your skills and help people, right? I mean, the biggest thing we're doing is helping people with your skills. You have that ability to help people and have a tremendous impact in their quality of life and their family.
Along those same lines, this is a good question. Do you think being a great surgeon is a gift or a potential that some ophthalmologists have, or can practice make anyone great in the operating room?
I don't think I don't think it's all natural. I think maybe 10% is natural. The rest of it is what you bring to it. And it's not the technical part even. It's the mental part. The mental part is really what propels you to be that, if whatever someone calls an excellent surgeon. And that's that mental preparedness, that cognitive thinking. And by that I mean, like working through problems thinking things through, approaching things right. I think that's more important than the actual physical talent you have with your hands. In all the residency and fellowship fellows I've trained over the many years at U of T, I can't think of really anybody I thought didn't have the physical skills to do their surgery. Once you get into residency, I think you're already there. But I think mentally, though, the mental approach and the cognitive approach, the mindset and the cognitive approach, two different things are there, because you can get coached and trained to do that. And you're going to have to learn yourself to coach and train yourself, because, of course, you can't be a trainee all the time. So yeah, that's my feeling. And I see that. I see that for, I think, all of you here, incredible at the end of the year. And I always feel a bit sad because I see at the beginning of the year, you start off and you're kind of this, I wouldn't even call it like a blank canvas. You're not a blank canvas. You guys come into this fellowship fully tainted and taught a certain way, which is good and bad. And so, you've come this whole way, and I see how you are now, and you may not realize it, but the way you think has changed, the way you approach things has changed, and that's manifested into you guys doing amazing cases, and challenging surgeries, which at the beginning of the year, you had the same physical skills as you have now. I don't think that's the difference. You practice them, yes, but physical skills and the hands you have are the same. So that's what I would say.
This question, Rabia Borkaza, did you go through a period in your career after training when you lost your confidence in surgery? How did you deal with that? How did you overcome that?
Yeah, I would say yes. I would say in my first year in practice, I think, even routine cataract surgery sometimes ends up being, you do it, but it ends up being like a 30-minute case. It's like, what the hell, right? I'm fighting with cortex, I'm fighting whatever. And so you do kind of doubt yourself. And then when you first have your first few challenging cases, and don't forget, when I got out there, I didn't do a single iris suturing case. I didn't do any kind of capsular tension segments. They didn't exist actually anyways, right? Or sutured in implants or iris fixation, or I did none of that. Right? And so I had to learn it all on my own. And when you do that, of course, you end up, of course, having more challenges. And so, yeah, those first few years, no question, I had more doubts. And even now, it's less so now, but there are times where I walk out of the OR and I'm thinking like, shit, like what the hell, man? Can I still do it? Am I able to? Should I still take on these cases? Am I capable of it? So, but yes, we all have that. As a resident, I did. I remember I went through a string of like, I couldn't do capsulorhexis, no matter what. I couldn't do good capsulorhexis, and no one really told me why I couldn't do it. Everyone was like, okay, just do it right. But you know what? The way I was holding the instrument, I was gaping the wound, I was torquing the eye, viscoelastic acid coming out. I wasn't thinking about physical vectors. That's what the problem was. And when I broke it down, because I do it to break things down in a logical way, it helped me to kind of move past that. So you will have those doubts, find out why they're there, and have a way to manage those.
What about as an anterior segment surgery, kind of overcoming that hurdle of like pars plana approach? You do a lot of stuff there. Are you going to just make good friends with your retina buddies and have them be on standby? How do you learn that?
Yeah, that's an area which is depending where you're going to work. In the U.S., for example, people do fit in their certain mold, right? And people have their own specialty, and people don't like to necessarily traverse over other specialties. So that may limit what you can do. I was fortunate in my residency. I wanted to be a vitreoretinal surgeon for my first few years in residency. And so I went down that line, and I was very surgically interested. So I kind of made myself learn that really well, and that helped. I visited surgeons, and then I picked the right cases to start and move on to that. And now I've become comfortable with it. But yes, I think having good friends in the retinal world, colleagues to work with side by side, really important to help you before and after surgery, and to sometimes manage if there's a complication. So for sure, we don't want to be on your own on those things for medical, legal reasons and other reasons as well. But do within what you want. I have other colleagues who work with other retinal surgeons in the OR, and they will do combination cases, which I think is fantastic. Do combine cataract, glaucoma, retina. Perfect.
Awesome. All right, guys, chime in. I've got some more. Top 3 tips for a new surgeon.
Sorry?
Top 3 tips for new surgeons.
For new surgeons, I would say, get down to the basics, learn the basics. I mean, learn phaco-dynamics. I mean, most people don't understand how to set up a machine, let alone understand how phaco machines work. So learn that really well. Watch hands, and don't just watch the surgical video, but watch what's happening around is important. I think those would be important things. I'd be curious what Ala and Tissi and Valentina feel about that, because they're closer to it. What do you guys think are important for new surgeons out there? Throwing it back to you guys.
I think, as you said, like, watch the basics. I think when I started residency, there weren't that many great videos, like literally going through one thing, like, oh, how do you perform a great capsulorhexis? How do you do a perfect chop? Like, I think Cataract Coach, it's such a good resource. Dr. Oding has amazing videos. So I think, just as Ike said, like, learn the basics and learn them really well. And once you can do that, then you can continue going a little bip more advanced.
Also, I think one thing that is important is to be persistent, because in the beginning it's going to be all like so hard, and you keep thinking, oh, maybe I was not born to do surgery and everything. But I think to be persistent is very, very important.
I want to say, echo what Tissi just said. Like, this whole year, I never did phaco chop in my program, and this whole year I was struggling so much with my phaco chop. So much that until 2 weeks ago, I finally felt like I dominated it. And it was so funny, because even Matt, remember that you were like, oh, I want to learn how you chop, Valentina. And then another person who's coming here also told me that, like, I want to chop like you. And I was like, if they really knew that a week ago I was still struggling with this technique. So really, like, make it possible. It will happen. People will tell you they want to chop like you. So I never thought I was going to hear that.
I think a key thing is videos, like watch a lot of surgical videos and review your own, critique your technique. Whenever I get out from an OR, I always like critique, okay, I did this wrong, like I could have done it in a better way. So like, never assume that you're going to do an extremely perfect case. Otherwise, you're going to lose track of learning. Like,
yeah, I think that those are absolutely great pearls. I'm just reading some of these. So many good questions. Unfortunately, I don't know. We won't be able to get through all of these. There's so many interesting things. Jason Jones asked a good question. How do you decide your surgical limits? It's a good point, because as much as we're talking about bravado and, like, go and tackle the world, how do you know your own limits? I mean, I think that's a really important one to think about. At the same time, I mean, I more often see people who think their limits are too low, and I try to get their limits higher, as opposed to the other way around. But it can happen as well, where you go past your limits. And I think, again, it goes back to those basic concepts. First of all, of course, if you've had a complication, to rewind and think about what happened and why it happened, or a bad outcome. And I think that'll hopefully teach you, maybe you went beyond your limit, or you would do things differently. I hate the word limits, honestly. Like, I don't like the word limits in general, because limits to me, reduce the potential of somebody. And I would always think people have unbound limits, but that's not the reality. Of course, I know that. So I think I think you want to sort of cautiously move forward in your what you're doing. Don't just jump and do the most complicated, dislocated cataract with pseudoexfoliation, 80-year-old dense cataract. Instead, choose maybe a younger, congenital zonulopathy or trauma. Maybe trauma is a good one, where there's no vitreous in the AC. You have a localized dialysis, so you can do first and get comfortable with managing that. Although both our fellows, Valentina and Tissi, recently done some pretty tough cases and jumped in there, and they did amazing. Those sometimes are challenging to jump in for the first time. But I think the concept of knowing your limits, or at least thinking about your limits, is important. But I would say your goal should be to kind of break through those limits, but do it in a safe way, because we have patient safety, which is really important. I don't want to be reckless. I don't want to sound reckless. And take advantage, for those of you that are early in your career, to go and visit people and visit and learn from those examples.
I want to put a plug in at some point for upcoming Prism Rounds on September 12th. We're going to critique and review learners' videos, so if you guys submit your videos on the website, send them to me. We'll take a look at them and go through them and give tips. You can send them anonymously too. So.
Yeah, that should be a good session. So hopefully some of you will be able to submit some stuff in there. I'm just reading some of these things. There's a question from Lucia about when you address how do you address if you have an idea and it's something different, and then others are saying you're wrong, but then you turn out to be right. How do you manage the situation? So in other words, you have a great idea or you think it's a good idea, and everyone's saying no, Ike, it sucks, but you turn out to be right. How do you manage that? It's a really good point, and it happens. I think being gracious is important, right? I too often see people, even if the speaker, like there's a speaker speaking and they're totally doing the wrong thing. I mean, try to be gracious about it. Now, of course, I'm not the best person to say this in my fellowship. I'm more blunt in the fellowship. I'm like, no, I can't do that. I guess in that environment, maybe I need to change, but whatever. I think probably in that environment, I'm like, in the moment, and we're just kind of like, no. It's just I'm very blunt in that environment. Maybe I need to change that. So, but I think with people you don't know well, like strangers or other speakers, like I always cringe when I hear someone go up there and say, you gave the most useless talk. You're so wrong. I mean, like they may be wrong, but let's be gracious about it and be respectful about it. I mean, that's what's important. Have a dialogue. I don't think we should be shy to contradict people, but do it well. And I think do it gracious. And at the end of the day, if you're right, eventually the world will know and people will know and it'll be out there. And whether you get credit or not, who cares? As long as it's the right thing that you're doing for your patient and yourself, that's what's important. And prove it. I would say, I mean, that's why I've been a big. I was never a researcher. I didn't do any formal research training. I read my own books on statistics, and I wanted to prove things to make sure that I was doing the right thing. So I did studies. I built my own research department. I hired our own research folks and brought on colleagues that had research interests to be able to help with that. So, prove it. The point is you got to prove it. In this day and age, you can't just say something. I too often see, by the way, one tip for young people, be careful going out there and saying, yeah, this is the best thing to do, or I did 3 cases and this is the answer to glaucoma, right? I do see that a lot where people use anecdotal experiences to say this is safe and effective, for example, right? Safe and effective is a very powerful word. I rarely use that word unless we have a really huge, study to look at this. Always put in a tinge of like, perhaps this is a possible way to do it. I think too often we're too definitive in what we say and how we do it. And I think it's better to be, again, a little bit more, step back a bit and do it in a more, I don't want to say humble, but a more, thoughtful way.
I like this one. If you wanted to learn a new surgical technique, can you learn it just watching videos online, or do you have to go somewhere else to learn?
I guess it probably depends on the stage of training. Like, for example, for you guys already, you're at the point where you don't need to go learn anymore. You guys have already done it. You've been there. And I think watching the videos should be enough, plus or minus artificial eyes. Now, this is something I'll put back to you guys, because traditionally in our fellowship, we haven't gone and done artificial eyes and model eyes and everything to practice. And we kind of just watch a video of Valentina and watch me a few times and then go jump and do it. But I do think that additional step, I'm going to guess, because I asked you guys for that answer, is a great way to kind of just think about your positioning and other small things that you can't watch from a video. But yeah, I think you should be able to. If you're a resident, of course, then you're going to have some formal guidance on that. But if you have the basics and the way to learn, you'll be good. Watch your videos and build from that. But what do you think, Valentina, about that?
Yeah, exactly what you said. I thought I could have learned it from a video, but actually at the hand positioning, you don't get that from there. So I love watching you, but then when we go in the OR, we realize that we're not putting our incisions in the right position. So you're telling us exactly what to do. So I do think you can learn online, but maybe go somewhere and do an observership to see the person you want to learn from and listen to what the person has to say. Then whenever we have observers, like, you keep talking and teaching while we're doing the surgery, and those points that you give are so good. So yeah, it depends on the level of training. I would agree.
Absolutely, yeah. And I think Rita mentioned a good point about just, being comfortable with the microscope. Too often we're sitting there and your neck's like this, or your hands are not well supported. And those are so important, right? About getting comfortable and setting yourself up well for that. But yeah, Valentin, I think yours and I think, this year what you guys have done with the artificial eyes, I think has been really good. And I think we're going to continue doing that. Matt and Irfan and Patrick, I think you guys have your model eyes. I think you do. And a wet lab is set up for that. So that's pretty cool. See, I mean, I think this is a great example about how people bring in great ideas. So I appreciate that.
Are we going to leave the black eye question unanswered and be mysterious?
I can answer that. I can answer that. I'm just looking at a few other things about traveling, what places has the biggest impact. I don't know. I mean, I hope everyone has a chance to travel, and not just for traveling, but to go and participate in meetings and even do surgeries, because it's such an unbelievable experience to see how other people do things and the culture and the learnings of it. When I travel, I make it a point to hardly sleep, because I'm so excited about everything that's going on that I stay up late and I wake up early and I can sleep on the airplane, because you only have a short time. Only have a short time when you travel. And I will even add that that's kind of my life too. You only have a short time on this earth, right? And like, let's not regret our time. I mean, I can tell you, like, I mean, it's funny. I mean, even my fellows probably see this now. I mean, we spend a whole year together, right? And we've seen each other all the time. COVID was really sucked because we couldn't see each other a lot. And now at the end of the year, I'm like thinking like shit, I wish I spent more time with each of you. Like I really, like and I do this other years, I'm sure I'm not just saying for 1 year only, but I'm like, this particular year was difficult, but you always wish that you could spend more time with people who you're with or do more things. And so I don't know, I think sleep is overrated. You can sleep, when you're alone or whatever, but when you're with around people, like take advantage of that opportunity. And maybe it's just me. I know I probably will burn out quicker than other people do, but you're better to burn out fast and furious than have a slow, boring, candle slowly burning away. For me, I'd much rather be the former. That's just me though, not for everybody. So, yes, Ramsay.
Yeah, I was going to ask you, like, and there's no doubt that you have changed the glaucoma world. You are connected with so many ophthalmic communities all over, like Asia, Europe, Africa, all over. My question to you is, like, when you started practicing glaucoma, it was kind of static field. Didn't you ask yourself these questions? Why am digging into this static field that I don't have much to contribute to patients who are like dying anyway? Were you anticipating that you are going to change this complete world and make glaucoma on the rise and people are like more aware of it?
I don't know if I have or I could make a change, but I certainly wanted to. For me, I chose glaucoma because everybody was going into cataract and refractive, and that was sexy. But glaucoma, nobody was really kind of interested in. And so for me, I kind of, when I see a crowd somewhere, I kind of say, well, maybe I should go the other way, and find my own place to be. And so, for me, glaucoma was that place, and I wanted to, try to have an impact. And I was very much surgically inclined. And what drew me to glaucoma was the fact that we had surgeries that were 40, 50 years old and still doing them. And I thought, wow, that has not evolved very much. Surely there's a better way. I don't know the better way, and I still don't know the better way completely. But that's what personally drew it to me. I didn't choose the safe option, I guess, right? I chose the less safer option. And in that sense, it's kind of like living dangerously, and it's probably everything that I've done in some ways, and it's a bit, I don't want to be reckless, but it's at the same time, push yourself in a different direction. So yeah, that was my thought. And I'm happy with how we're thinking differently, but I'm also very frustrated because glaucoma is a tough one, right? We still have too many failures. MIGS doesn't do enough. Drug delivery is not what we thought it would be right now. We're still struggling, but I think we're better. We have more options. So great.
Sorry, I have one.
Yes.
Someone asked, do you have any rituals before you proceed with surgery?
So a couple of things. When I wake up in the morning, I should have mentioned this. Someone asked me this. I always say a prayer, I believe in God. I mean, and I don't, if someone doesn't, no problem. I guess it's, for me, I should be more religious actually, but I would always want to do more, but I believe in God. I believe in spirituality. I think that kind of helps me to guide me through tough and thin times. And I always pray to God that please help me to help my patients today and people I'm with. So I always do that every day in the morning when I wake up, and it could be whatever, right? But for me, it's a prayer. And then I do like to listen to music. So I like to kind of feel like I'm kind of, the juices are going, we're kind of moving, we're doing all that. I used to have more rituals than before. I mean, I still, of course, look at my list before. I visualize what I'm going to do. I used to do it the night before. I used to go through my list, and I used to go to sleep, and I used to be thinking about what I'm going to do, where my hands will be, what the steps will be, and I go through it through my mind. It becomes a bit more automatic, as you guys see, and you do that less. But I don't think I have anything superstitious. I do. Oh yeah, well, a couple things. I do a couple things. First of all, scrubs. I got to be in comfortable scrubs. You guys know this, right? And I kind of have to change it because of COVID, right? Because they have new scrubs you got to wear. I like to wear my scrubs a certain way. I like to have the first part of it tucked in my waistband and then the back of it left out. I have to have that. Okay. I know it sounds funny. Okay. That's my ritual. I have to have, ideally shoe covers on, which maybe have a couple little holes on it, right? Kind of makes me feel like I'm worn in already. I'm broken in already. So when I put my shoe covers on, purposely, you guys don't see this, I'll make a couple holes in it, or I'll kind of rub it a bit, right? I have to have my surgical cap down to here, almost covering my eyes, because I'm just so used to it, and I feel like I'm protected by a helmet. I have to have a mask that also is really tight against my nose and bent, and I like to keep the bottom part loose a bit. I'll go with COVID. You got to be careful with that, so I don't fog up top. I guess those are some of the rituals. Yeah, I mean, that's probably what I would say. I don't know. It sounds kind of weird, eh? I don't want to say too many else. I do change my underwear every day. Don't worry. That's funny.
What's the story with your hairstyle?
What's that?
What's the story about your hairstyle?
Oh, okay, yes.
Yeah.
Well, when I was a medical student, I had really short hair, like number 1 on the side and 2 on the top, like a buzz cut. I have to show a picture of this, these little pictures. And then as a resident, I had the same. And then in the middle of my residency, I don't know, I kind of had that moment in my life where things just switched, where basically I think I kind of figured out who I was a bit. I gained a bit of confidence, in surgery and stuff. And I also then kind of respectfully thought that, it's my time to kind of be a bit rebellious. And I don't want to be judgmental, but there were people in residency who were saying, you got to wear a tie, you've got to shave, right? Clean shaven is the way to go. Keep your hair proper, and have a tie and a press shirt and everything else. And I respect that. I think there's something to be said about, the respectful environment. At the same time, all that does is encourage cloning, being like everybody else, right? And so, and I think that's not a good way to think. We should be thinking not like that. We should be encouraging diversity. And so, I basically didn't cut my hair for a year, and didn't trim my beard for a year, which is almost like it was now, although I trim now. And so I got some flack for it, but then it just kept on going. And then when I went to my fellowship interviews, I cut my hair again, and Alan Crandall said, "Why did you cut your hair?" And he was like a little pissed off. I was like, "That's supposed to be who you are." And since then, unfortunately or fortunately, I guess I've somewhat been associated with it. So I don't mind. I don't mind it. I don't mind it right now. It's okay. It's kind of a bit of a pain. I need a haircut. But it's more of a nuisance than anything else. And it's always messy, as you guys know. It's always messy. It's never tidy. And so, but I don't want it to, I sometimes worry, I don't want it to be the distraction. I don't want to make it like, oh, it's all about the hair or anything. I'd rather it not be that way, but I realize it is. And if it's my contribution to ophthalmology medicine to not conform, to respectfully not conform and not offend people, but do it in a way that you show who you are yourself, then that's good. So if your style is to have a nice short haircut, perfect. If your style is to have highlights in your hair, which are okay for a guy to have highlights if you want, by the way, nothing wrong with that. So you could go do that, right? If you want to grow a beard, right? If you want to be a person, if you're a man, woman, or anything else, show that and be who you are. I think it's beautiful to do that. Be beautiful who you are. I think it contributes so much, and that's kind of maybe where that came from. But now it becomes a joke and everything else. I always enjoy it, have fun with it, and one day will, when I do cut my hair, believe me, it'll be like I will shave my hair all off probably. It'll be like that extreme. It'll be that extreme. Won't be like a middle ground. No middle ground here, guys. That's funny.
I don't know how many more we have time for. There's one at the top here, though, that's been hovering. What will you be doing in 10 years time, 20 years time? inside or outside of ophthalmology?
So I often tell you guys, and I think I probably ask Allah and Tissi and Valentino, what are you guys going to do in 5 years? What are you doing in 10 years? I ask people that, but I'm the worst guy to think about what I'm going to do next year. I'm the worst guy for that. I think I'm very much in the moment, and I'm a very bad planner for those kind of things. I very much just think about what I'm doing now, and I figure out things will kind of work out in the end. It's a very bad attitude I have on that. And I think I've been blessed by having people who pray for me and people who help me out and people who guided me, family and everybody else and friends and colleagues. But I think probably for me, I mean, clinically and surgically, I feel great. I feel that I have enough people around me that can continue that. I mean, I don't need to do every surgery. I have great colleagues. Our preceptors are excellent. I mean, I'm hoping they will lift up the load more and take on more teaching and stuff. For me, I kind of like some big picture stuff. So I hope I'll be more doing system stuff, maybe sitting farther up, maybe not being hands-on as much, and do all those things. And I could be even ready to do that now. But it's funny, but the one thing that prevents me from doing that is I just know if I do that, then this fellowship won't be the same. And that's probably, I hate to say this, I know it sounds funny, because I could literally step away right now. And clinically, we have doctors in our group who could take care of things. Research, we have it going on. And I love to do some stuff. I mean, work on the tech side of things, work with Google, work with other people who've already touched base with this stuff, and everything else. But I know that if I do that, then this fellowship will not be the same. But it's changing, right? I mean, in a few years, we have people coming up and junior faculty who will be taking more leadership. And I think it's always important when you are a leader or you're a director is to know when to step away, right? Give people another opportunity. Like, don't hold a position forever. Like, don't hog something, right? I mean, I believe in term limits. Maybe I'll bite my tongue, but yeah, I mean, really give someone this opportunity to do something. So I hope that'll happen. And that's the plan. I do have some regrets in life. That wasn't a question I had, but my biggest regret is I always dreamed of climbing Mount Everest. That was my dream as a kid. And maybe I can still do that dream, but I need a few months off to do that, right? And I can never do that right now. So maybe one day I'll be able to do that, just to be able to do it. And when, just like the people have done it before, why do you want to climb Mount Everest? Well, because it's there, right? The same thing with many things in life, because it's there. So I hope I can do some of those things. I still want to be in Canada. Many opportunities to go in the US and probably have an amazing opportunity. And I've seen opportunities that have come my way and have lab and have support and work far less. But I wouldn't have what I have here, which is, but the best country in the world, in my opinion. Family around here, a nice healthcare system and stability. And I think in this day and age, if anything, COVID has taught us, having a stable place to live where you're comfortable, not only from disease, but also from social injustice and other issues that happen in poverty and stuff. We're very privileged to be here. And so that kind of thing, I think, is intangible. So that's what I would say. I still love other countries. You know that. Come on. And you guys know which country I visit the most. I won't say anything more than that. So
we got to get to, I'm going to keep reminding you, got to tell the black eye story.
Yeah. So I think I've spoken way too much. And I appreciate all the great questions. I think there's more than one way to do things. So the black eye, well, I mean, it's nothing too incredible. I didn't go and save a family from a burning house and anything like that. No. Basically, this was during fellowship, as I was saying before, and it was like kind of in March or April. Like I said, just literally a week before I broke my wrist. And I had pictures. I should show pictures. I have a black eye and I have my wrist in a splint, and it was my right eye that basically had the black eye. And what happened was I was playing basketball, and I had a group of friends playing. That I met at the university, and we're playing against some folks that we didn't know, and one of the other teammates was really kind of pushing someone and being rude and almost to the point of fighting, right? And so basically, like I try to do, I try to stand up for people that are being bullied, and I stood up to the dude. I'm used to that, right, as a kid. And so we basically got in a fight. I mean, literally was a fight and fisticuffs. And I don't remember where it happened or what happened, but I ended up, having a fractured orbital rim. And so I had a fractured orbital rim. I had diplopia. And I was like, holy shit! Now I'm in trouble. I didn't think it through. Well, I should have thought it through more. And so yeah, I had swelling and I had a broken orbital rim. Luckily, it didn't require surgery, and the diplopia, which was predominantly from swelling, resolved. But for a few days, a week or so, it was pretty bad. So I had that, and so that picture was taken because the photography department was like, we're all laughing, and we basically created a picture of like a prison picture where I was posing, saying a prisoner number underneath and wanted kind of thing. So yeah, sometimes you're lucky and sometimes you push your limits. I could have been a lot worse, of course. I could have ruined my career. But the funny thing is, I don't know if you guys believe me or not, I probably would do the same thing even today. I probably would. I'd be more worried about getting shot. Not so much in Canada, but I probably would do the same thing. I mean, I was literally, you may not remember this, I was literally at Mandarin. Mandarin's an all-you-can-eat buffet Chinese restaurant with a bunch of family. And there were kids walking in the parking lot, and this guy just motored it on his car. He just floored it through the parking lot. I was like, what the fuck? I mean, why would you do that? So as he was driving by, I literally punched his passenger or his driver's side window, right? I punched it pretty hard. I think I posted on that one on Instagram. And I was like really ticked off, and that was stupid to do, right? The guy could have run me over. The guy could have gotten out. I think he got scared of me because I was pretty upset. He started getting out of his car, and then he turned around and went back in. But that was pretty stupid, right? So I haven't learned my lesson yet, and probably one day I probably will get in trouble. But so there's some things some things that are hard to stop. You guys sometimes see me around where I probably do things I shouldn't do. So hopefully learn from my mistakes, but also know that sometimes these things happen. They can turn into be a blessing in disguise as far as working around them. So it's always about that limits and whatever's your fate is. That's my one of my last things to say is that not that you should accept your life. Don't do that, but push as hard as you can. Do everything you can, and then when you have something in front of you, understand it's there for a reason. Like, don't accept it, but say this happened for a reason, and I can either react to it negatively and take something bad from it, or I will learn from it and grow from it, and I'll be hurt, and I'll be scarred, I'll be damaged, whatever, but I will grow from that, and I'll accept that. I don't know what my fate is. I don't know what my fate is. I don't know if God will keep me here for a long time. The feeling the way my life is going, I go pretty fast and furious. So that's probably if I can't predict what's going to happen, but that's probably going to be me, right? You're probably going to be on the news somewhere, maybe for a bad reason. Hopefully not, but So that's the black eye story. Awesome. And thank you for Nepal. That was a great invitation. Daki Sherpa, nice dream to climb Mount Everest. Most welcome to Nepal. Okay, that's one of the best things that came out of this meeting. I'm gonna touch base with Daki and set it up.
You got to do it.
I'm gonna do it. But thank you very much for being here. Maybe I want to finish off with the team because I wouldn't be here without my team, without the fellows, without people I work with, and I never work as closely with the team. And this is an opportunity to say this because I know you may say, "Hey, Ike, it's the end of the year, whatever." You say whatever you want, but I really genuinely mean this. I thank you three from the bottom of my heart for everything you're doing. Hey, Allah, look who's there. And I know how hard people have worked. And I know you've done it with unbelievably great intention. And I will say I have high expectations of myself and others. And I sometimes push that. I know I push that too hard. And I push people really hard. And I sometimes create a bit of a barrier because, it's hard to be, chummy and friendly and also be a taskmaster. I find that hard. And I think Patrick is sweating now and Irfan and Matthew. But I always struggle with that a little bit, right? Because, and even with my kids, right? How do you find that balance? It's kind of that balance act. But when your kids get older, right? Then I think they realize all those hard times. I hope they realize, and I realize it, that, that was for a reason. And you get that friendship level, hopefully, and you get that really nice. And that's what I hope with my kids, you get that friendship level. And that's what I do hope and see. I hope I see that. And so congrats for an unbelievable year. And the toughest year is being a fellow for so many reasons. COVID, we've never had this situation ever before. So I want to just give everybody a chance, maybe starting with Allah, just to share to the world your thoughts, and I look forward to all of you sharing what you're doing when you go back to Saudi, back to Brazil, back to the U.S. I want you to be that limelight, and I think that you will shine that light in your cities, in the places you work. So maybe I'll have you guys go around. Maybe I'll start with Allah just to share some of your own points, and certainly feel free to teach me a lesson and tell me off.
Well, it was a really.
Days, by the way.
I'm sorry.
I said, but you still have a couple more days. I'm kidding.
Yeah, I know. Yeah, well, it was an incredible year for me. It was more of not people would think like you would join the GAS fellowship just to kind of have to sharpen your skills. You want to become a better surgeon, or doing new innovative stuff. But it's more than that. It's more of like self-discipline. You teach yourself how to become a better surgeon. You explore your limits and you kind of upgrade them and try to become an even better surgeon. You push yourself to the uncomfort zone and you come out of it as a better and improved person. And you keep this mentality for the rest of your career, I would say. It was a really humble and incredible experience for me. And so thank you so much for being such a mentor and for pushing us to our limits.
Well, thanks, Allah, and I thank you for really listening and being being so professional and putting up with me, because you do put up with me. I know that. I know you put up with me, I just see the incredible confidence that I see in all of you and you as well, Allah, here, and I feel confident with you, right? When you walk in and do things, it's amazing to see what people have come and you will be. I know you have great ambition, and you should. And you will be, and you are a great force for good. And when you go back, you're going to do amazing things, and we're looking forward to it. Your preceptors have said the same thing. I agree with that completely. So thank you for that. Valentina, I'll move it over to you.
Yeah, so I just want to say what Ike said. Nothing is impossible, and I want to tell everyone who's listening right now that you can make it. If you really want something, you'll make it. Like, I never thought 3 years ago that I was going to be a GAS fellow with Ike. Like, I remember the first time I heard about him, long hair, was at an ASCRS meeting, and I heard him talk. I was like, who is this guy doing these surgeries that I've never heard of? So really, if you see someone at a conference and you really like their work, like, reach out, like, don't be scared. Open your ophthalmology, they all want to meet you, and if you show enthusiasm, they want to take you. They're going to be a year with you, and they want to make sure they get along with you. So just go and talk to them, not just like about a case, just ask about their families, what they do as a hobby, So that would be my advice. And I think this year, I'm so excited to go back home, whatever that is, and to share. I do like global work, so I would love to go many places in the world and actually teach, more than just doing my surgeries myself, teach the people there so they can do it.
That's great, Valentina. I mean, you were doing this for many years. I mean, sharing your knowledge, right? As a medical student, as a resident, you had that kind of mindset to kind of share and help people, which I think is incredible. Which is what really attracted me to you and really wanted you to be here. And I think that you're going to continue doing that. And I love that attitude and the approach. I told you before, I told you this one-on-one about your special talent, and I push you to kind of use that talent. I think sometimes I also see, where you don't realize the talent you have, and I think, I've told you that before, right? I think that you're tremendously talented and you already show it. And it's not just doing a surgery, but it's also how do you communicate it and how do you share it in the right way. And I think you already have a big fan base already, as you know, which I think is amazing, and you're going to continue doing that. So I'm looking forward to seeing you land and do great and do well. And we're all connected here, which is beautiful. So thank you. And Tissy, I met as an observer back. It's almost 2 years ago, and she's our first Brazilian with us. So
yeah, and I just when you said that impossible is nothing, I just remembered that when I came here to do the observership, when I met you, I said, hey, I applied for the fellowship, but I know it's impossible. And you were like, why is it impossible? No, there's like so many people from all the part of the world. And yeah, I'm here. So like as Valentina said, like when you have a dream, go for it. And this year it was great, and it was like even more as a professional, like I would say we're challenged to develop as a human being, as a professional in our surgical skills. So it was great, and I'm so thankful for all the teaching. Yeah.
Well, thank you for all everything you've done, Tissi. You've added, you know, an extra element within the fellowship in terms of what you brought in your approach, not just being from Brazil, but also just the way you look at things. And I think, you know, this is a great example about how I learn from people and observe them and what they do. And you know, you going back now to Brazil and sharing all your experiences and everything else. I think I'm very excited for you and what you're doing and how it's going to happen. And you know, Brazil is one of my favorite places to visit. So I know we're gonna see you there as well.
I have to visit Fortaleza.
Now I'm gonna go to Fortaleza.
Anymore.
Now Fortaleza is the center of Brazil for me now.
Yeah.
I'll want to also. I've already talked about Ramsay. Ramsay, you're in the middle of your clinical research fellowship. I don't know if you have any words you want to share to those here. And I want to mention again. I mean, when I speak about myself or ask other people to share their ideas, it's not because my idea or their idea is the best idea. It's just great to hear people and everybody who's here with us together. And I know there's many attendees. I mean, everybody has an amazing thing to share. And so by no means do I mean that this is better than anything else. But it's great to hear people's perspectives. So Ramsay.
Yeah, actually, I'm grateful to Valentina, TC, and Ella. I mean, they were so helpful. They answered my questions. It was like great working with you. And this year was really great year to me and to my family to spend here. I got to know Ike more, which is like very I'm so privileged to know him. I'm looking forward to work with Patrick, Irfan, and Matthew for next year and to keep on improving my knowledge and my clinical skills as well. And thanks, Ike. Thanks again for keeping me here one more year.
No, it's been amazing, and thank you for being part of this, Ramsay. You know, your story, which we won't have time to go through here, of course, but it's an amazing story. But you get your story in life as well, which I'm super amazed with. And I don't know, I want to thank you know, Patrick and Irfan. You guys are just new on board. I won't put you on the spot too hard, but you guys will be part of the team now. You guys have some huge shoes to fill, as you can see. And you know, once you're part of the family, it's an amazing camaraderie to see. So thank you. And Matt, maybe I'll let you add some last comments, because this is kind of something you put together. I appreciate it. It's been fun. I hope it wasn't too dry and too monotonous. But I'll hand it over to you for a bit.
Thanks, Ike. Yeah, no, this is just what we wanted. Just kind of pick your brain on all sorts of things and get, you know, you're full of inspirational stuff, and really appreciate that. Coming from outside of the gas bubble, you know, just watching your fellows operate is, you know, these last couple of weeks have been amazing. So, I mean, that's your product, and seeing what you do, you guys have all been inspirational already. So if I can be a shadow of that, you know, when I come out at the other end, I'm sure we'll all be sort of thrilled. Anyway, but yeah, thanks again for sharing. And, you know, you're an inspiration to all of us. We're really privileged to have you stay here for us, you know, because I know that's what it is. And we do all, you know, appreciate that. So congrats, guys, who are graduating. Honestly, you know, I'm excited for you to, you know, get out into the real world outside of the gas bubble and see what you can do. You know, it's going to be awesome.
Okay, we got to get a picture here before we finish off. The ritual picture. So everybody get all ready here. Irfan, comb your hair. I'm kidding. Okay, smile. Awesome. So thank you very much, everybody, for listening. And I feel like I've taken up a lot of your time. And I think life is very much as you know, Matt said, about, you know, inspiring others and being inspired yourself. And everyone has the ability to do that. And in the end of the day, it's really the people that you have with you. When you're at the end of your life, I mean, we're going to remember the people that we're with on our journey. Most of all, you're going to remember the people that we're close with, even the people you maybe just met for 5 seconds, but that person had an impact on you. Or maybe people you've lived with their lifetime. I mean, that's in the end of the day what we really take home, and not our accolades or our credentials or our trophies or even our surgeries. I think it's going to be the people that we're with, and who's touched our lives. And so I wish you guys well. The next time we have rounds. Tissi and Valentino will have been graduated, so we hope to have you guys back as always welcome and teaching as well. And we'll carry on the tradition as we always try to do every year. So thanks everyone for joining us. It was really nice to get everybody here in a nice conversation, and I appreciate all the questions. Sorry we couldn't get through all of them, but it was a pretty fun time to talk to everybody. Enjoy the rest of the weekend.
Thank you. Have a good time.
Thanks, guys.
Thank you, everyone. Bye.